The public deserves complete and thorough transparency and accountability from the medical system. I am an absolute strong believer in that and always have been.
Dr. David Nash is a patient safety expert and an advocate for public reporting systems. He's the editor-in-chief of the American Journal of Medical Quality. He was one of the first to publish a study comparing Philadelphia hospitals against their track records for open heart surgery. He says public data improves care.
We also have had literally 2 decades of public reporting, maybe not always about wrong side surgery, but certainly about the outcomes of many different types of surgery. So I firmly believe that public reporting has contributed mightily to reducing wrong side surgery, reducing postoperative infection.
State adverse event reporting systems were created in response to reports studying preventable medical errors. A Health and Human Services Inspector General report measured medical errors in Medicare patients who went to the hospital in October 2008. Of the 1 million Medicare patients discharged during that month, the Inspector General found 1 in 7 experienced an adverse event.
Medical error, all medical error that is preventable, is the 4th leading cause of death in our country in 2016, and it's hard to believe.
I thought it would be a really good idea for Iowa to expose to the public in a very scientific and straightforward way, one that had been approved by 28 other states, and make those kinds of events transparent.
Dean Lerner used to run the Iowa Department of Inspections and Appeals. That agency inspects hospitals. He believed implementing mandatory public reporting would improve care in Iowa.
If you ask an Iowan whether having this information would be valuable and important to them in the scheme of things in terms of their care, they will tell you yes.
Lerner brought his proposal to the Hospital Licensing Board back in 2010. The minutes of 2 meetings show the board had a lot of questions. How would this data improve care? What had other states experienced? How would the data be used? The former chairman of the Hospital Licensing Board, Bob Miller, says those were critical questions.
It did not appear to us that there was a plan to what to do with the information that would be gathered.
Miller said the board also felt a state-run public reporting system was redundant.
We felt that there was a lot of reporting going on through the collaborative and required by CMS and for our relicensure, Joint Commission of Accreditation, all had criteria there.
The Iowa Healthcare Collaborative has gathered data voluntarily from all hospitals in the state since 2007. Its CEO, Dr. Tom Evans, says the group publishes a report comparing hospital performance across the state.
The never events are a starting point. They were a very popular thing to start talking about in the early 2000s, but we've moved so much farther beyond that.
But he says the report has flaws. It's very technical, so patients in the state may not understand what is being compared and why those comparisons are important. He says they're working on improving it.
We want consumers to be engaged with meaningful information. So we have other things, tracking infection rates and antibiotic usage and falls and pressure ulcers.
Evans believes focusing on never events like wrong side surgeries is distracting.
I want consumers engaged. I want them looking at this information, and we want to be transparent, but we've got to give consumers meaningful information that they can make good healthcare decisions based upon.
Miller says those concerns were key in the discussion.
Is it going to improve quality care, or is it going to penalize an error?
Lerner says he needed the board's support to move forward with a state public reporting system. He planned to answer questions as they came up.
We didn't want to, jump with both feet before we, carefully, analyzed everything. Was to take this one step at a time, and I honestly thought that would help industry to adjust and get comfortable with the change.
At that meeting back in 2010, Chairman Bob Miller twice called for a motion on the proposal to create a public adverse event reporting system. No one on the board made one. The idea died without anyone casting a vote. Never events at Iowa hospitals continue to remain hidden from public view. Iowa hospitals are not required to publicly report never events to anyone. Patient safety advocate David Nash says adverse events should be public knowledge.
If we're going to have consumer engagement in healthcare and consumers having more skin in the game and higher deductibles, they have every right to be able to connect the dots between what hospital is in my network and what are the outcomes of care for procedures that I may need or family members need in those institutions.